Hello and a very good evening to all of you. Thank you for joining this webinar. My name is Dr. John Latham, the National Clinical Director of MInTFM, and we have arranged this webinar especially for those of you who are interested in training to be family medicine specialists. So presented by MInTFM, this webinar for the Malaysia-Ireland Postgraduate Training Programme in Family Medicine. The first thing I'm going to do is run through the agenda and do a little bit of housekeeping, if you like, for the webinar. The webinar will last about 1 hour, we hope. So firstly, we'll begin by hearing the voices of doctors who are already involved in MInTFM and are working or being trained by the programme. The teachers, that is 2 scheme directors, will be talking to us, and the trainees, 2 of the young doctors who are already being trained by the MInTFM programme, are also going to share their experiences with us. So I'll spend some time asking them about their experiences and sharing how the programme is working for them. I will then give an overview of the programme with some details of the structure and the unique features of MInTFM. In other words, the educational components and the assessment system, the examination, and indeed the career-changing professional rewards for those who do graduate. Then we will look into the entry requirements and indeed how to apply, as well as talking about the fees for the programme. Finally, and very importantly, you can take part in this webinar because we do have a question and answer section, and you'll be able to write your questions for the panel. And please use the questions function on your screen, if you don't mind. Your devices will be muted, so you won't be able to be heard on the webinar, but you're very welcome to use the questions function to write questions for the panel. And please start writing those questions before my presentation finishes, so that we have the questions in good time for myself and the panel to answer. So the first thing I'm going to do, and it gives me really great pleasure to invite the Central Region Scheme Director in the KL site, and that is Dr. Azan, who is the Scheme Director for the Kuala Lumpur site. And I'm just going to ask you, Dr. Azan, thank you very much indeed for joining our panel. I'm simply going to ask a very simple question. As a very experienced FMS doctor of a good few years experience, what made you choose to be involved with MInTFM and become a scheme director? And the second part of the question, I guess, is what do you think is so special about MInTFM?
Hi everybody. Thank you, Dr. John. Okay, as we know, primary healthcare is a very important component of the Malaysian healthcare system, and it actually has developed leaps and bounds. And it is the first level of contact of individuals, family, and community with the national healthcare system. So, Ministry of Health Malaysia is constantly looking for ways to increase the number of family medicine specialists who leads the public primary healthcare clinic. Hence, the MInTFM was approved, giving more opportunities for doctors to specialize in the field of primary care. After seeing the needs and feeling responsible for the development of future family medicine specialists, I agreed to become the scheme director for MInTFM. And after looking at the curriculum, which has been developed in tandem with the Malaysian background and scenario. So yeah, I feel sharing my knowledge is very rewarding, and we hope MInTFM would produce more primary medicine specialists and help Malaysian primary healthcare system.
I'm glad you mentioned the curriculum, which people may be asking about. The curriculum was developed from an Irish GP training curriculum, but I think you and quite a few other experienced Malaysian doctors were involved with adapting it to the Malaysian healthcare system. Did you find that interesting, or how did you find that went?
The contextualization, yes. You mean? Yeah. Yes. A group of us sat down and we did the curriculum together, and it's very interesting. And that's not so many changes though. It's almost similar, but there are certain diseases that is peculiar to Malaysia that we have to station.
Yeah, I think it's very interesting that family practice, or general practice as we call it in Ireland, the core skills and the core values and the core professional parts of the work of a family medicine specialist or a GP are roughly the same in different jurisdictions. Thank you very much, Dr. Azad. Really appreciate the work you're doing for MInTFM, and thank you for answering our questions.
Yeah, you're welcome.
My next guest, if you like, is one of the trainees in Dr. Azad's central program, and Dr. Anu Mala is a trainee who began with the program just last October, and so is experiencing the teaching and the experience of working as a trainee. And my question for you is, again, relatively simple, but we'd love to hear your view. What made you choose family medicine as a career? And the sort of added bit to the question is, and how are you finding MInTFM?
Good evening to everyone, and thank you, Dr. John. I actually had an experience prior to coming to MInTFM. I was working in Sabah, and I had a very interesting experience that gave me a different perception of family medicine. When I was treating a particular patient in Sabah and district areas, they are coming from very rural areas where they have to earn 2 months' money to actually come to the hospital. So I had this incident where I had a patient who came over with his wife and then subsequently asked for medications for his father, uncle, children, and then it was the neighbor, and then in the end it was for the next 10 people. Basic treatments actually that they were not able to reach. But the point was, I realized that I wasn't treating this person physically. I was also treating his family and then a community. And that made me realize that there is a lot of scope and a lot of areas that we still have not reached and still can reach by doing family medicine. And the biggest thing that I saw was that you're not treating one person as physically, you're seeing them emotionally, you're seeing them from their mental state. So it's a very holistic approach. And I think what really captured the interesting and kept me going in this was the fact that family medicine, you involve all the departments. So you do master, but you are the jack of all trades. So it's very interesting to have a case or a position or a patient where you need to involve many departments. You learn every day. It's a challenge, and it's a very interesting puzzle also, where you can actually help an entire community.
Thank you, Dr. Anna. That's really interesting, and it encapsulates, I think, most of the important parts of what being a family medicine specialist is, and the interest and, in a way, the challenge. The other question, briefly, was how are you finding MInTFM?
I'm actually finding it great. I myself has actually invited some of my friends to join in and to put in their applications, and they have. I personally, I love the fact that the first 2 years we have the hospitals. So I'm actually directly under the specialist, and I think this has really boosted up my confidence level in seeing the patients. So that, I think for me, that is the plus point.
Yeah. Thank you so much for joining us, Dr. Anna. I hope you stay as a member of our panel. Our next interviewee is Dr. Winnie, who is also a trainee. This time she's in the Northern scheme with Dr. Shri and based in Penang. And my question for Dr. Winnie is not particularly different, but it is, you've been a trainee in MInTFM since October. Again, why did you choose family medicine as a career? And my sort of add-on question for you is, how are you finding the rather unique weekly day release program that we have? Maybe you could say a little bit about that as well. Thank you.
Good evening, everyone. Thank you, Dr. John. Well, frankly, family medicine hasn't always been my first choice, but the most memorable experiences and patients that I've met definitely came from my health clinic days, and triggering me to reconsider my options probably late of 2018. So my previous health clinic adopted the family doctor concept. Thus, the same doctor cares for the entire family, be it the diabetic and hypertensive grandparents, the pregnant daughter, or the asthmatic grandson. Well, there's once I have had a mother telling her 3-year-old daughter that I was a doctor who examined, palpated, and scanned her while she was still just a fetus until she was born to this world. And now I'll be treating her for upper respiratory tract infections. Hence, she shouldn't be scared of me or be shy. So, and I even had grandmothers who come like every 3 months with uncontrolled blood glucose and a packet of homemade goodies, which were cookies which are simply sweet but definitely tasty during every visit. But often I would have to convince myself that they are here to get their medication so that their diabetes is better controlled, rather than the intention of them coming over for the sake of a chatting session or just to hand me some goodies. However, it is these experiences that I had with my patients in the health clinic that motivated me to join the family medicine fraternity. So honestly, I can't help but to admit that I do look forward in knowing if my patients' homegrown mangoes survive the wrath of the monkeys this year after being savaged last year, or if a patient's drug addict son finally quit the habit and found a stable job in a city, or if her daughter-in-law is due to deliver her 10th grandchild next month in Australia. Well, to me, medicine is not merely about treating an illness or fixing a fracture, but it's also about healing the mind and mending the heart of the patient. So, and family medicine gives me the opportunity to treat every patient holistically and as an individual human being and not just a sick object. I guess that's why I decided on family medicine.
What a fantastic answer, Dr. Winnie. Thank you so much. The little subsidiary question I have, which is also quite important, is how are you finding the day release, which is embedded in our program? Maybe you could describe that a little bit to us.
Yeah. Well, for the northern region, our day release is actually on the Wednesday, held every fortnightly, alternating with the virtual class. Well, for most of us, we actually look forward to the day release, as we'll literally be able to be released from our work in our hospital and be brought back into family medicine. Well, it's a much needed break of the week after being saturated with hospital management and on calls. Many of us eagerly anticipate the opportunity to meet up with fellow trainees to talk about our different experiences in various hospitals and departments, or simply to catch up socially over a cup of coffee on our drive to the venue of the day release. So besides that, the day release also gives us the opportunity to meet up with our scheme directors and assistant scheme directors to discuss any issues that are facing the hospital, to get some advice regarding our case-based discussions and logbooks, also to clear some doubts or misunderstandings, which is a wee bit difficult to be done over WhatsApp Messenger or even over the phone. So our day release typically starts with our scheme director, Dr. Sriwayu, making a roll call just to check on our attendance, and then the trainees given some time to voice out their questions or to raise any issues. Usually about a week prior, we would decide on what to discuss during our day release, be it a case presentation from the current hospital postings by the trainees, critical appraisal of a journal, or a family medicine related topic by the trainers. For example, so far we've gone through like essentials of primary health care, communication skills, several diabetes topics from Essence, which is the Academy of Science and Continuing Education in Diabetes and Obesity, We have even attended a workshop on high-risk pregnancy, safe motherhood, and obstetric emergencies during our day release, which covered some hands-on obstetric life-saving skills and multiple thought-provoking topics such as schizophrenia in pregnancy, hepatitis in pregnancy, diabetic nephropathy, and retinopathy in pregnancy. So I think it's fair to say that our team director and our assistant team director have put in a great deal of effort in making our day release informative, motivating, interesting, and definitely relevant to family medicine. So
Thank you so much, Dr. Winnie. As you can see, there's great enthusiasm amongst our trainees for this particular part of our program, which is really a really important part of postgraduate education for our young future FMS candidates. Now, it gives me great pleasure now to go on to interview Dr. Shri, who is the Northern Region Scheme Director at the Penang site. Dr. Shri is well known as present president of the FMSA also. And my question is relatively simple, but I'm sure the answer will not be that simple. It's simply, what do you think that MInTFM can do to help in the development of family medicine in Malaysia?
Okay, thank you, Dr. John. You are putting me the last person to speak, and mind you, I did not ask Winnie to say what she had said. Okay, so it was a very independent opinion with regards to MInTFM and also the directors. Okay, I have to say that first and foremost, thank you very much, and also congratulations to ICGP and the MInTFM task force with regards to having the program in Malaysia. So we have been into this program since October, and I think we have slowly matured in terms of training and also in terms of the communication, rapport, and all the things that we need to prepare, and also the things that we need to make sure this program works and becoming a very successful parallel pathway for the Malaysian system. And also to bring in family medicine specialists in Malaysia. And as you all know, that DG last year announced that Ministry of Health in Malaysia, or Malaysia per se, needs around 8,000 FMS to cater for the population. But I have to say that it's an underestimation. Actually, we need more than 8,000. Okay. Now, what we can say is that MInTFM has actually showed to us, we know that it's a curriculum coming from Ireland ICGP. We have went through the curriculum, we have actually conceptualized the curriculum, and we make it as Malaysia as possible so that none of us become Irish at the end of the 4 years. Okay? All right. Okay. So what I can say in my experience becoming a director currently, and also trying to reflect on the current practice of family medicine in Malaysia, I have to say that the MInTFM really blends very well with the Malaysian system. Okay, and the Ministry of Health and the health system in Malaysia needs this kind of training for family medicine specialists in the current situation. Why do I say that? Because number one is the hospital posting that is part of the training, and then the continuous relationship and also connection between the trainees and also the trainers who are actually our own FMS in Ministry of Health, and plus the fact that we also will have another 2 years of primary care posting. Now, this kind of posting training curriculum or structure really blends with the current Malaysian system of health. And I have to say that because of this, I can see that the trainees has actually matured very well, and they have adapted to the system, and they have given lots of good accreditation to this program. What I have to say is that I will have to make this kind of confidence is that the MInTFM allows doctors, more and more doctors, to be trained to become FMS in the future. It may be a little bit daunting now with the fact that we have the COVID-19 on board, but it is happening everywhere, okay? But I can assure you, MInTFM will be a very popular, a very likable parallel pathway to train doctors to become a family medicine specialist, okay? And I really salute and congratulate the team, the MInTFM team and the ICGP. What I can say with the fact that the trainings are being blended with the current Ministry of Health system, I do see that the FMS trainee are becoming more and more exposed to the system, and we are actually preparing them for the primary care in Ministry of Health and also in Malaysia. And we hope that these trainees actually, they become strong, they become confident, and they can accept, or they can work and they can react to the current situation, because I see primary care in Malaysia is going to evolve. We are not just looking at acute care, chronic care, but we are actually responding to COVID-19 pandemic. And I can tell you, I have to praise myself and my colleagues out there in primary care that because of our hard work, we are able to contain the spread and the transmission of COVID-19 with our aggressive screening. And this is only achievable if we have doctors in primary care, we have doctors in family medicine, we have FMS leading the primary care clinics, and this is only going to be a reality if they do have a very good training program. And because that our trainees are actually with us at the ground level, we actually discuss things that is so relevant to the current situation of health in Malaysia, and they are not going to be influenced by so much of hospital care, but making the hospital care an experience to then get all this experience and knowledge to be adapted into primary care. And because of the day release and also the virtual class, we slowly from year one train their way of thinking how to become a primary care physician, even though you are currently doing the hospital posting, and then looking at how from the hospital we can actually look after our patients. Now, there's going to be a huge challenge for us. Why do I say this? Now, the COVID-19 is not going to go away. It's going to stay with us. Now, we are looking at how are we going to manage our patient in this COVID-19 era, and we family medicine specialists will have to try and adapt to how to make consultation, clinic care as safe as possible, reduce and contain the transmission of COVID-19, even though we are in the primary care with our patient, and to try and control the condition as much as possible. So I have to say that because of the training of MInTFM really going into the system per se, our trainees will become superb and matured by the end of the 4th year.
Thank you so much for such a good endorsement of what we are trying to aim for in MInTFM. And I'm glad you mentioned how important FMS service in the fight against the COVID-19 has brought our specialty to the fore, not only in this country, but in many other countries. I know back in Ireland, general practice will never be the same. And despite the tragedy of this, it has brought our specialty to the fore in a way that we could never have imagined before. Thank you so much, Dr. Sri, and indeed all of our 4 panelists who will stay with us, I hope, especially for the question and answer session later in the webinar. It's now my turn to describe MInTFM in some detail, where MInTFM comes from and how the program is structured. Firstly, to say that MInTFM is a collaboration between 3 academic partners. The first one will be well known to many people in Malaysia, RUMC, or the RCSI UCD Malaysia Campus, which was formerly known as Penang Medical School, is our partner on the ground, if you like, in Malaysia, based in Penang, It's actually also the headquarters where I am based, where my office is based. Many people will know that RUNC was recognized as the 10th foreign university branch campus in 2018. The next, and these are in no particular order, the next partner in our program is the Irish College of General Practitioners, the ICGP, which is the body founded in 1984, and I'm old enough to be actually a founding member of the college. It's the examining body for membership of the Irish College of General Practitioners. It provides CME. It also oversees and looks after training in Ireland, and is a very recognized academic body. The third of our partners is iHeed, and iHeed is a medical educational organization. It is based in Ireland also. It's a worldwide, global player in, and very experienced in providing postgraduate medical education virtually using electronic and virtual means. And iHeed provide us with our really unique electronic platform, which performs as a teaching aid. It also provides us with what you might call an e-portfolio for each trainee, and it allows us to very efficiently deal with our assessments and our logbooks and so on. So those are the three, if you like, academic partners. Now, I think we've already heard from our four speakers why they have decided to be family physicians. But just to do a little, maybe run through some of the ideas that may be going through our participants' minds as to why they might be family physicians or family medical specialists. Family medicine is recognized as being absolutely essential to the universal health coverage of a population. And our Ministry of Health in Malaysia is very, very determined to improve the number of FMS people on the ground throughout the country because of this. Primary care, of course, is the first place of contact for most people with any illness or any complaint. Some people call family medicine or general practice the gatekeeper. In other words, the part of the health system that looks after nearly every illness and occasionally transfers or refers it to secondary care or hospitals. Family medicine is in the front line for chronic disease management, and that means management of non-infectious diseases such as diabetes, heart disease, hypertension, which are such important causes of morbidity. So we deal with paediatrics, women's health, mental health, family planning, amongst all the other disciplines. As somebody said earlier, we have to deal with every aspect of medicine. We're not micro-specialists. We have to deal with multiple comorbidity, which is becoming more and more common, particularly as our population is aging. And finally, and I think you may have picked this up from our four panelists, family medicine is actually a career to be proud of. This is a rather crowded slide, and I apologize for that. I will mention again that this webinar, if I didn't mention it earlier, is recorded, and recording will be sent to each of you so that if you miss something or you want to go back to it, you will be able to do that at your leisure. Some of the details of the program already mentioned. We use the curriculum that was developed by the Irish ICGP, but it's been adapted very carefully and in some detail by Malaysian family physicians to the Malaysian healthcare setting. The course is 4 years, full-time. The clinical training in hospital placements takes place in years 1 and 2, and the rotations in hospital are through the main specialties. In other words, medicine, paediatrics, O&G, psychiatry, and the other subspecialties such as ophthalmology, ENT, dermatology are not neglected either. The clinical training in the healthcare clinics, the Klinik Kesihatan, in years 3 and 4, are supervised by accredited family physicians or family medicine specialist trainers. The rotations through the main specialties in years 1 and 2 will be supervised and assessed by heads of department and perhaps the designated specialists as well in the departments. As we mentioned earlier, there is a 1-day release from clinical work every single week throughout the 4 years of the course, where small group teaching takes place every second week, and alternate weeks there is virtual teaching using a virtual teaching tool. We have been using Zoom, but that may be changed to another platform at some stage. And this is facilitated by the scheme directors, but the small group teaching and the day release is very much directed by the needs of the trainees involved. And they're very much involved in providing the material and the subject for the teaching, basing it nearly always on cases that they have seen. We use advanced online learning environment platforms for education and assessment as well. And we mentioned that iHeed is the provider of this remarkable tool. There are live virtual classrooms and learning modules which will be presented again using the iHeed system throughout the years, 4 years. The hospital training component, just to mention it again, gives the trainees a really broad range of experience in gaining knowledge of all the different disciplines. So the importance of the hospital 2 years are learning your clinical skills, that is examination, learning procedures, becoming more skillful in ordering appropriate investigations, all of which will be invaluable to you as an FMS in later life. Decision making, being able to make decisions quite quickly using what evidence, clinical evidence that you have in front of you. All of these things are part of the hospital training component. Of course, as well, the gradual increase in your clinical knowledge increases during a good clinical rotation in a hospital department. The health clinic or KK component is really important, and it's another 2 years, years 3 and 4. And as I mentioned earlier, the training takes place with the very close collaboration with your FMS trainer. Each trainer will have maximum of 2 trainees, so it's almost a one-to-one mostly with your trainer, and you will learn attitudes, skills, knowledge, all these appropriate aspects of what it makes what makes up a really good experienced family medicine specialist. The relationship with the trainer is really crucial, and as I've said here, it's rather like an apprenticeship, and a lot of trainees model themselves on the behavior and the professionalism and the ethics of the trainer who they spend so much time with. So they learn professionalism, the trainees learn leadership skills, all of which are part of being an FMS after 4 years. Holistic knowledge and individual care and community care have been mentioned by our two trainees. I think both of them mentioned how important it was to have an overview, not just of the person, but of their family and the context of where they live. And that is learned to a great deal in the family medicine training component. Of course, consultation skills are hugely important in family medicine, and we will be training trainees using video analysis, which a lot of trainees find it a little bit difficult, but then enjoy it because it is the way to learn how to consult really well and efficiently. A lot of people have asked about the MICGP exam, the membership of the Irish College of General Practitioners. It's a criterion referenced examination. It's in 3 parts. The first part is called a Core Knowledge Test module, or CKT, and that's a multiple choice. The second module is called a Modified Essay Test module, or MEQ. So the first 2 parts of the exam are usually taken in year 2, whilst the trainee is still in their hospital posts. The third part, called the Clinical Competency Test, or CCT, takes place usually in 3rd year. So in 1st year, there's no examinations, and in 4th year, there's no examination. And I think people find that rather relieving and really a good thing. The examiners for the examination are from Ireland and from Malaysia. I think it's important to mention that the MICGP is exactly the same qualification that Irish GP trainees get. So Malaysian and Irish graduates will have exactly the same qualification, which is accepted in Malaysia, in the UK, in Australia, and in Ireland. As I've said, the examination usually takes place in years 2 and 3. You will hear of a certificate of satisfactory completion of specialist training. Just to say that this is a certificate that the RUMC, as the university or medical school partner, will assign to each trainee who has finished the 4 years to the full and passed all their assessments and handed in all their logbooks and attended correctly. So the MICGP and the certificate of completion are will be required for recognition for placement on the NSR, the National Specialist Register. And at the end of 4 years, after just 6 months of gazettement, the successful candidate will then be fully qualified to become a family medicine specialist. You'll be glad to hear I'm nearly finished going through all the slides, but it's important that people know what the entry requirements are. You must be a Malaysian citizen. You must have completed your internship. You must be registered with the Malaysian Medical Council and be a qualified medical officer under the Ministry of Health. That is, you need to be employed by the Ministry of Health on application. Another very important thing that people obviously always ask are, what are the fees? Well, the fees are 25,000 ringgits per year. And these fees also, they include the MICGP exam fees. So there are no extra exam fees or hidden extras, if you like, within the course. For those who are qualified or are able to receive MARA scholarships, they are available to pay for the full fees. Bank loans with reasonable rates have been offered by the AFIN Bank, and some trainees have been releasing EPF or KWSP funds as well in helping to finance their training. The application forms and applying. I have to say that the applicants are coming in slow to start, but applications are now coming in at such a rate that I would advise any of you who are serious about applying to do so pretty quickly. Our closing date is on the 3rd of May, which is not that far away. The programme is scheduled to commence in July 2020. At the moment, that is our scheduled starting date for the first posting. And some of the details people ask me about are employment and continued employment with the Ministry of Health. Same terms and conditions continue as you go through the 4 years of the scheme. There is an interview, and I must say now also that those who are applying, as I say, you should apply quickly, and if you wouldn't mind applying with full details filled in on your application form. You'll find on the application form that there are 3 spaces for what we call reflections. And it's really important that you spend a little bit of time reflecting on your undergraduate, your professional development and your personal development, and just sharing with those on the application form. So I would really recommend those of you who are going to apply to put in your applications pretty quickly, and we look forward to seeing them. We now come to our question and answer session, and I am not sure whether I can see or hear any questions at the moment.
Hi John, it's Brian here. I can relay a couple of the questions from the chat. There are lots and lots of questions coming through, and we've been answering as we've gone along here. Good. One of the questions is just about the location. So you can currently train where, and what's the plan for the future, please?
Right. By the way, Brian, who is aiding me here, is one of our colleagues in iHeed. And thank you for relaying the questions. If you don't mind feeding the questions to me, that would be great. I can't see them on my screen at the moment. Sure. The location of, or the 2 sites at the moment are the ones that we've heard from today. That is the Northern Corridor Scheme, which is based in Penang and Kedah. And so that is one of our sites. And at the moment, we also have Central Scheme, which is based in KL, Kuala Lumpur. As we increase in numbers, we're very, very keen to and are very prepared to move to other areas. And eventually, we do hope to cover the whole of Malaysia. But those are the 2 sites at the moment. Have you any other questions?
Okay, there's a question here, John, just about the day release 1 day per week throughout the 4 years, which is correct. Yes. But can we take our own Cuti Rehat, which I think is a holiday? Is that right? Are we still eligible for 25 days per year, same as government service?
Yes. Yeah. Obviously, and we would call it annual leave or holidays. Yes. The certificate of satisfactory completion at the end will take into account a 75% attendance rate, both at hospital teaching and at the day release. I have to say, so far, we've almost 100% attendance for all our trainees in both the schemes. So obviously, holidays are allowed and will not detract from satisfactory completion. Equally, people also, while we're on that topic, ladies do ask about maternity leave, and of course that is statutory right, and it is built a system for looking after trainees who are on maternity leave is there as well.
There's a question, John, about is there an entrance exam? Could you tell us a little bit about that process, please?
There is no entrance exam. As we've talked about, the application form and submitting your documents, that is your application form itself with the reflective pieces, the documents which also include your degree transcripts and all those sort of things are required. There is going to be then an interview for those who are shortlisted as suitable, and the interview will be taking place, we think, the end of May, beginning of June. We haven't fixed a date. The interview will be virtual. It will be done by Zoom or Skype or some virtual means. Under the present conditions, we imagine that there will be no opportunity to actually sit down with people. So the interview will be exactly the same as ever, but will be done virtually. No exam is required.
Okay.
Hopefully that's
and there's a question there about the number of intakes per year. I think we can answer that one pretty easily. It's just one intake per year.
Yeah.
A question about how does the MOH keep employment during this study time or during this training? So I believe that's just as the contract remains the same. Is that right, John?
Yes. Some people have asked, some people, I think that's important. A few young doctors who've told me that in Malaysia at the moment, there are some young doctors who are on a short, maybe 2-year contract, and worry that that will run out during their time with MInTFM. I've been assured by senior people that that is not going to be a worry, and that if you have that fear, you should still apply for MInTFM, and if successful, enroll in our scheme. So employment will remain, and your contract will remain the same. But if you have a shortish contract which you're worried about running out, we're 99% sure that that will be extended, so that you will continue. You will complete the 4-year program.
A few people, John, asking about.
John, we have.
Oh, sorry.
Yes.
Yeah.
I think
Molly.
Another colleague.
Yeah.
Hi, sorry, Dr. Molly Owens here. I just looked into a few of the questions here as well, John.
Yep.
People are asking about where the location is. I think somebody seems to think that we're just in Penang, so maybe we could talk to them about where they'll be located. They're also asking about what actually happens when they start the program. Are they sent to a hospital, or how does that work? Yeah.
The first part of the question, where are we located? Well, in the northern scheme, we are located, if you like, our base is in RUMC, but in fact, Dr. Sri works in Kedah, and so quite a lot of the teaching happens there as well. The hospitals are spread between Kedah and Penang. I think the second part of the question was you start on day one by starting your hospital. You will be allocated a 5-month posting to one of the hospital specialties, and in the first year that will be either medicine, OG, or paediatrics. And so on day one, you will join the Department of Paediatrics, Medicine, or ONG under the auspices of the head of that department, who will be responsible for either teaching or delegating teaching for you. So on day one, you'll actually start your posting in the hospital. Hopefully that answers that person. Any other questions?
There's just a few minutes left, John, before we get to the end of the hour, and I was wondering, we have Fintan, the Chief Executive from ICGP, on the call. Do we want to give Fintan a chance to say a few words there?
I'd love to, yes.
And also Prof. David in RUMC. Yes. I know there's over 100 people on the session today, so there's just too many questions coming through to answer them all. But we can transfer all of those onto the FAQ on the application page. So we'll answer all of those questions within the FAQ. And also there will be an education advisor reaching out to everybody who's registered today. So you'll have a chance to talk one-to-one with one of our education advisors. So I will just try, David, if you wanted to go first, actually, since your camera is already there.
So Professor David Whitford is CEO of RUMC and has been very much involved in setting up the program. So David.
Yeah, thank you, John. Yeah, I'd just say a couple of words. One is, you know, I'm a family physician by background before I went into academia, and one of the strengths of the program MInTFM in Malaysia, and one of the main emphases that we set it up with is that it's actually run and organized, and the training is done by family physicians. And one of my great beliefs is that the training of family physicians should be done by family physicians as opposed to by academics, which happens in many centres. And it's not to decry the academic sort of route, but certainly that's one of the strengths of the MInTFM programme. And I think you probably came across listening to some of the speakers beforehand that is there. And that was one of the aims of setting the programme up in the way that we did, that actually all of the training and the scheme directors and John as the National Clinical Director are all practicing GPs, practicing family physicians, and that is what is really the strength of it. And I've moved from being a practicing GP many years ago to being an academic, and I can tell you quite honestly that you do lose touch with what being a full-time doctor in family medicine is like. And so having people full-time in family medicine train you is the ideal, in my view. If there's anything that I would say is the strength of MInTFM, it is the family physicians who've been involved in Malaysia in setting it up. And they're a great group of people, and they're a very, very strong core of people to train you in the future. And the other thing I'd say is that, you know, as John has already said, family medicine is really the core of any good healthcare system. And that's been shown time and time again by the research. And this is with my academic hat on, I can very firmly say that the research points very strongly to the best healthcare systems in the world, having the best primary care systems in the world. And there's no doubt about that secondary care has a very strong place in healthcare, but the real strength of preventing disease and making a difference in the community is actually family medicine. I don't think I can say much more. I mean, I was a full-time GP for 16 years. I never regretted a moment of it. I loved it. I went through training in the UK, and then I was professor of general practice for many years. But it's a great profession, a great branch of medicine to be in, because you make so much difference. You get to know people over a long period of time who become nearly like for your own family. And it is such a different experience to any other branch of medicine.
Thank you so much, Professor David. I appreciate that. I'm afraid I'll beat you a bit, because I've been a family physician for 36 years. And don't regret any single year of it. Yes, there are tough times, and it's not an easy job, but it is a fascinating career pathway. Thank you so much. I think, Fintan, are you there?
Yeah, we just need to unmute it.
I think we're going to be talking to the CEO of the Irish College of General Practitioners, Fintan Foy.
There you go, speak.
Yeah. If he's not there, there we go. Hello, Fintan. Great to see you.
Sorry, are we hearing Fintan?
No, I can't. No,
no, I don't think so, Fintan.
Not.
We can't hear you.
Can't hear you,
Maybe
Fintan.
take out the headphones, Fintan. Try out the earphones. Pull those out and let's see.
Oh, he's lost.
No. No, unfortunately not today then, John.
Okay. Fintan is a huge supporter of our, as I say, ICGP is one of our partners, and as a CEO of the Irish College of GPs at the moment, he's extremely busy with the involvement that family medicine in Ireland is having, also with the COVID-19 pandemic. General practice in Ireland has always been thought to be important, but it has become so important to both the public, the government, and the Ministry of Health there, as primary care is the crucial part of the care of people who may or may not have COVID-19. So I'm sorry we're not speaking to him, but perhaps are there any further questions that Brian might have from any of our 100 visitors this evening?
Just, John, there are some questions about if you're not in the Northern Corridor or in the central area, if for instance you're in the east, what could you do? Is it that you have to transfer at the moment, or if there's enough interest, could we open up in the east?
At the moment,
south for that matter.
As we speak, unfortunately, relatively early days, you would have to transfer at least temporarily to either KL or to the Penang or Kedah area. As the program grows, and I believe it will grow extremely quickly, we are definitely going to be opening schemes in other parts of both the peninsula of Malaysia and also in Sarawak. We have very, and we've got great support and enthusiasm from the Ministry of Health to do that. But at the moment, unfortunately, just as we speak, we just have the two sites. Any other questions? Because our hour is almost up, and I really do hope that the 100 or so of you who are out there are still have your screens switched on. I think the most important part of our webinar have been the voices of the two young doctors and their enthusiasm for our scheme and their, if you like, their ambition to become FMS specialists, which started in different ways with different people, and also their enthusiasm for the program that they're experiencing at the moment. And also the two experienced family medicine specialists, Dr. Shri and Dr. Azza, who have fantastic experience. They're both very good medical educators, and they're extremely busy FMS doctors working harder than ever because of the COVID-19 pandemic.
John, could I ask two very quick questions?
Yes, do.
Two very quick questions. There's about 30 or 40 questions still to be answered, so we won't get through them all today. But one is just if I'm finishing my housemanship in August, so that's just a month overlap, could I still apply for the programme? That's one. And the other one is, how long is the assessment after?
Okay, sorry, ask the second question again, yeah?
How long is the gazettement period afterwards?
Okay. The first question, you do, as I said earlier, one of the requirements is that you are currently a medical officer. So therefore, the timing would not quite fit in. If we're starting in July, timing would not quite fit in if you finish your postman job in August. However, next year will come along very quickly. So I do recommend that you keep your eye on our application and our website to apply next year. With regard to gazettement, I think I mentioned earlier that it is just a 6-month gazettement following graduation from the scheme before you become a fully fledged family medicine specialist and join the specialist register. I think perhaps the question, it's nice to know that there are so many questions out there. We, as Brian said earlier, we will be dealing with each question by adding it to our frequently asked questions, our FAQs, and answering it on our website. If anyone would like to email individually to our email address, I can guarantee that that will be answered by somebody with expertise. And I'll just, before I say good evening and good night to everybody, I just want to thank you for joining us. And if you are encouraged to apply, again, I'll just repeat myself again, please apply soon. And we really look forward to seeing those applications coming in. As I say, the deadline is 3rd of May. Interviews will be end of May, beginning of June. And as soon as applications are in, we will be shortlisting pretty quickly, and we'll be in touch with each applicant. So thank you so much. Thank you for the team.
Thank you.
Thank you.
Thank you. Thank you, everybody.
Thank you very much, everyone.
Thank you.
Thank you, Professor.